So, postpartum women come in for a variety of reasons to physical therapy following birth. Some of the more common things that I see are continued urinary incontinence or leaking urine for any reason. Leaking urine involuntarily for any reason might be typical, but it's not normal. So it's something that we can address as early as 6 weeks postpartum, but also as late as 6 years. Sometimes I see folks all along that continuum. So urinary incontinence is probably one of the top things. Along with that, prolonged pain. Pain can come from a variety of things as well. A lot of times there's tissue changes such as tears that require stitches. Sometimes that just needs a little support to help it along. If you're not getting back to pain-free intercourse within a reasonable amount of time, months later, that's a common reason that patients are referred to physical therapy to look at what the underlying reasons for pain during intercourse after having a baby might be attributed to. I would also say sometimes returning to preferred exercise routines is something that is a challenge postpartum and needs a little bit of special knowledge and care, maybe just some eyes on developing an exercise routine that's appropriate and paced in a way that will allow you to get back to what you want to do without creating more pain or discomfort, and also not creating any more damage to the healing tissues. So we also treat prenatal patients, and most common issues that I see relate to movement. So that might be related to too much mobility in the pelvis due to hormonal changes that create the changes necessary to prepare for birth, but might make it a little harder to move around. So pain with movement, whether it's in the groin and in the front of the pelvis, or low back down into the sacrum or the tailbone. Those are pretty common changes, and there's some really nice and easy supports and fixes for that. I think that it's really important to know that when you're pregnant, there are ways that a physical therapist can work with you to help you continue going to work, taking care of other kids at home, doing your daily duties for work, and maybe even all the recreational activities that you want to continue doing if that's appropriate per your medical situation. Not to let pain or muscle aches or soreness get in the way of enjoying your life through the prenatal period.